Question 71. The LPN is observing a client using crutches for a leg injury. Which action would indicate the need for additional education? A. The client places the top padding 1 to 2 inches below the axilla, with a firm grip on the handles. B. The client rests the axilla on the top padding and loosely grips the handles with hands. C. When going down the stairs, the client leads with the injured leg. D. The client has a slight bend in the elbow when using the handles. Correct answer. B. The client rests the axilla on the top padding and loosely grips the handles with hands. When using crutches, the client should avoid resting their weight on the axilla, armpits, as this can lead to nerve damage, axillary nerve palsy, and discomfort. Instead, the client should bear weight through their hands by firmly gripping the handles. The crutches should be positioned approximately 1 to 2 inches below the armpits, and the elbows should be slightly bent to allow for proper support and movement. This incorrect technique highlights the need for further education on the correct use of crutches to prevent injury and ensure effective mobility. Question 72. Which statement from the caregiver of a palliative care client demonstrates a proper understanding? A. The main therapeutic goals are comfort and better quality of life. B. We will need to stay in the hospital to receive this level of care. C. This treatment plan usually means the prognosis is less than 6 months. D. The medications to treat the underlying disease will be stopped. Correct answer. A. The main therapeutic goals are comfort and better quality of life. Palliative care focuses on relieving symptoms, managing pain, and enhancing the quality of life for clients with serious or terminal illnesses. Unlike curative treatments, the primary goal of palliative care is not to cure the underlying condition, but to provide comfort and support to the client and their family. This statement reflects a correct understanding of the approach to palliative care, which prioritizes symptom management and emotional well-being to improve the client's overall quality of life. Question 73. Which of the following actions represents proper ergonomic practice when the LPN helps a client get out of bed to use the restroom? A. Aid the client in sitting standing by lifting with the legs and keeping the back straight. B. Bend over the client to get a good grip when sitting the patient up. C. Let the client use your body to pull up in a sitting, then standing position. D. Lift the client into a standing position by using your leg and back muscles. Correct answer. A. Aid the client in sitting standing by lifting with the legs and keeping the back straight. The action of aiding the client in sitting or standing by lifting with the legs and keeping the back straight represents proper ergonomic practice. This technique ensures that the LPN uses stronger leg muscles to bear the weight and avoid strain on the back, reducing the risk of injury. Maintaining a straight back and using proper body mechanics helps distribute weight evenly and protects both the nurse and the client during the transfer, ensuring a safer and more efficient movement. Question 74. Which of the following would be an accurate example of using a color coding system for triaging clients after a natural disaster? A. Red is placed on a client who is losing a lot of blood due to massive trauma. B. Green is placed on a client with an occluded airway and difficulty breathing. C. A black sticker is placed on a client whose injuries prove to be fatal. D. Yellow is placed on a client who is stable and can wait the longest to be treated. Correct answer. C. A black sticker is placed on a client whose injuries prove to be fatal. In mass casualty triage, the black tag typically indicates that the client has sustained injuries that are incompatible with life, or that the client is deceased. This system helps prioritize care by identifying clients who need immediate treatment, red, those who can wait, yellow, those with minor injuries, green, and those who are beyond saving, black, ensuring that resources are allocated efficiently in critical situations. Question 75. Which statement should the nurse discuss to highlight the risk factors when caring for a client with known IV drug use? A. The use of these drugs can increase the risk of contracting diseases due to immunosuppression. B. IV drug use can lead to skin infections at the injection sites and poor health. C. Drug use can lead to unsafe sex practices, increasing the risk of the transmission of sexually transmitted diseases. D. The risk of contracting and/or spreading blood-borne pathogens such as HIV, which can progress to AIDS, is a huge risk factor with this activity. Correct answer. D. The risk of contracting and/or spreading blood-borne pathogens such as HIV, which can progress to AIDS, is a huge risk factor with this activity. Intravenous drug use significantly increases the risk of transmitting blood-borne infections like HIV, hepatitis B, and hepatitis C. Sharing needles or using non-sterile equipment facilitates the spread of these pathogens, leading to serious health complications. By addressing this risk, the nurse can emphasize the importance of harm reduction strategies, such as using clean needles and accessing treatment options to mitigate the dangers associated with intravenous drug use. Question 76. What is the best action for the nurse to take when working in a client's room who is positive for C. diff, Clostridium difficile? A. Don a mask, gown, and gloves when working with this client. B. Wear gloves and gown during client care. C. Wear gloves when having any physical contact with the client. D. Wear gloves and a mask when cleaning the client. Correct answer. B. Wear gloves and gown during client care. C. Diff is a highly contagious infection that spreads through contact with contaminated surfaces or stools. Wearing gloves and a gown helps prevent the spread of the infection by providing a barrier between the nurse and the client or contaminated items. This action is part of contact precautions, which are essential for reducing the risk of transmitting C. diff to other patients and healthcare workers. Question 77. Which of the following clients is least likely to develop hypernatremia? A. A client with diabetes insipidus. B. A client taking anabolic steroids. A client with extensive thermal burns. D. A client with chronic renal insufficiency. Correct answer. D. A client with chronic renal insufficiency. A client with chronic renal insufficiency is least likely to develop hypernatremia because impaired kidney function typically results in the inability to effectively concentrate urine or retain sodium. Clients with chronic renal insufficiency often experience fluid retention and dilutional hyponatremia, low sodium levels, rather than hypernatremia, as the kidneys struggle to maintain proper electrolyte balance. Hypernatremia is more commonly associated with dehydration, excessive sodium intake, or conditions where water loss exceeds sodium loss, none of which are characteristic of chronic renal insufficiency. Question 78. Which of the following clients is most likely to have an elevated glucose reading? A. A 34-year-old male with pancreatitis. B. A 29-year-old female with sickle cell anemia. C. A 56-year-old male with Addison's disease. D. A 43-year-old female who is fasting awaiting a knee arthroscopy. Correct answer. A 34-year-old male with pancreatitis. A 34-year-old male with pancreatitis is most likely to have an elevated glucose reading because the pancreas plays a crucial role in producing insulin, which regulates blood sugar levels. Pancreatitis, or inflammation of the pancreas, can impair its ability to produce insulin, leading to hyperglycemia, elevated blood glucose levels. In acute or chronic pancreatitis, the damage to the pancreas can disrupt normal insulin secretion, causing blood sugar levels to rise. This makes patients with pancreatitis more prone to elevated glucose readings. Question 79. Which common side effect should the nurse instruct a patient diagnosed with epilepsy about when prescribed valproic acid? A. Encephalopathy. B. Hallucinations. C. Hyperammonemia. D. Tremors. Correct answer. C. Hyperammonemia. Valproic acid is a medication commonly used to treat epilepsy, as well as other conditions like bipolar disorder and migraine prevention. One important side effect of valproic acid is hyperammonemia, which is an elevated level of ammonia in the blood. This can lead to serious complications, including confusion, lethargy, and, in severe cases, encephalopathy, brain dysfunction. Patients taking valproic acid should be monitored for signs of hyperammonemia, and if detected, the drug may need to be adjusted or discontinued. Question 70. Which of the following statements from a patient who has just returned from a thyroidectomy requires further assessment by the nurse? A. I have a headache. B. I hope I will be allowed to drink coffee now. C. My lips feel like they are tingling. D. My throat feels sore and my voice is hoarse. Correct answer. C. My lips feel like they are tingling. Tingling around the lips or fingertips is a common early sign of low calcium levels, which can lead to more severe symptoms if not addressed. The nurse should promptly assess for signs of hypocalcemia and notify the healthcare provider. Question 81. A patient prescribed clopidogrel, 75 milligrams, to be taken daily for the prevention of a myocardial infarction, asks the nurse why this medication is necessary. What type of medication does the nurse explain clopidogrel is? A. ACE inhibitor. B. Antiplatelet medication. C. Diuretic. D. Statin. Correct answer. B. Antiplatelet medication. Clopidogrel is an antiplatelet medication. It works by preventing platelets in the blood from sticking together and forming clots. This is particularly important for patients at risk of myocardial infarction, heart attack, as clots can block blood flow to the heart. By inhibiting platelet aggregation, clopidogrel helps reduce the risk of clot formation and subsequent heart attack. Question 82. Which of the following questions should the nurse ask next after the client expresses concerns about being kept alive on breathing machines? A. Do you have an advance directive? B. Have you talked with your family about this? C. I will make a note in your chart just in case. D. Your lawyer can help you draft up papers to deal with this situation. Correct answer. Do you have an advance directive? Asking about an advance directive directly addresses the client's concerns by determining if they have already expressed their wishes regarding life support and medical treatment. Question 83. The charge nurse is assigning patients and has delegated the LPN to care for a patient who had a chest tube inserted 3 hours ago. Which of the following statements is correct? A. The LPN will need RN assistance to administer oral medication. B. The unit charge nurse should be notified. C. This is an appropriate delegation. D. This patient should be assigned to a registered nurse. Correct answer. C. This is an appropriate delegation. When the charge nurse assigns the LPN to a patient who has had a chest tube inserted 3 hours ago, the nurse is delegating a task that is within the scope of practice for an LPN, as long as the patient's condition is stable and there are no complications. In most cases, LPNs are qualified to care for patients with chest tubes, as this is a routine procedure. However, the LPN should know the patient's condition and be able to monitor the chest tube for complications, such as infection or dislodgement. Question 84. Which of the following assignments would be appropriate for the UAP? Unlicensed assistive personnel. A. A patient rings the call bell and asks for Tylenol. B. A patient 2 days post-op cholecystectomy requires a sterile dressing change. C. A patient with new onset seizures needs assistance to the bathroom. D. A terminal cancer patient is being transferred to hospice home care. Correct answer. A. A patient rings the call bell and asks for Tylenol. The appropriate assignment for the UAP, unlicensed assistive personnel, is assisting with the transfer of a terminal cancer patient to hospice home care. This task aligns with the UAP's scope of practice, which typically includes non-invasive and routine care such as assisting with hygiene, mobility, and transportation. Question 85. Which of the following medications carries the lowest risk of causing tinnitus? A. Aspirin. B. Fluoxetine. C. Lasix. D. Gentamicin. Correct answer. B. Fluoxetine. Fluoxetine, an SSRI, selective serotonin reuptake inhibitor, has the least risk of causing tinnitus compared to other medications commonly associated with this condition. Medications such as aspirin, Lasix, furosemide, and gentamicin are known to cause ototoxic effects, including tinnitus, particularly at higher doses or prolonged use. Fluoxetine's mechanism of action primarily affects serotonin levels in the brain and does not typically lead to ototoxicity or auditory side effects like tinnitus, making it a safer option regarding this particular risk. Question 86. The LPN is caring for a client admitted with acute pancreatitis. Which medication would be the least appropriate for pain management? A. Codeine. B. Tylenol. C. Morphine. D. Tramadol. Correct answer. C. Morphine. The least appropriate medication for pain management in a client with acute pancreatitis is morphine. While morphine is a potent opioid commonly used for pain relief, it can cause spasms of the sphincter of Oddi, which can worsen the pain and symptoms in clients with acute pancreatitis by increasing pancreatic duct pressure. Question 87. The LPN is assisting a client who is taking Risperdal with their morning activities of daily living. Which task is most likely to be affected by this medication? A. Getting out of bed to use the bathroom. B. Drinking fluids. C. Brushing teeth. D. Eating breakfast. Correct answer. A. Getting out of bed to use the bathroom. Risperdal, risperidone, is an antipsychotic medication that can cause side effects such as dizziness, drowsiness, and orthostatic hypotension, a drop, in blood pressure when standing up. These side effects can make it difficult for the client to move safely, particularly when getting out of bed, as they may experience lightheadedness or unsteadiness. Question 88. Which advice would be most appropriate for a client under neutropenic precautions to help prevent infection? A. Only brush teeth once a day or every other day. B. Only use pads for menstrual periods. C. Do not let visitors within 10 feet. D. Wash hands when finished cleaning up after pets. Correct answer. B. Only use pads for menstrual periods. Clients under neutropenic precautions are at high risk for infection due to a weakened immune system. Using pads instead of tampons minimizes the risk of introducing bacteria into the body, which could cause infection. Tampons have a higher risk of introducing bacteria and potentially leading to toxic shock syndrome or other infections. Neutropenic precautions focus on reducing the client's exposure to any potential sources of infection, and using sanitary pads is a safer option in this context. Question 89. What should the nurse do if a physician orders the administration of ibuprofen, but the nurse notices the client is allergic to NSAIDs? A. Ask the client if he or she feels comfortable taking the medication. B. Find out how serious the client's reaction is to NSAID exposure. C. Administer the medication per the healthcare provider's order. D. Contact the healthcare provider to verify the order and discuss concerns. Correct answer. D. Contact the healthcare provider to verify the order and discuss concerns. Administering ibuprofen to a client with an NSAID allergy could lead to an adverse reaction, potentially causing harm to the patient. Verifying the order with the healthcare provider ensures that the allergy is considered, and the provider can make adjustments, such as prescribing an alternative medication. This step is crucial to prevent medication errors and prioritize patient safety. Question 90. Which of the following situations would be classified as an internal disaster? A. An earthquake occurs. B. A fire starts in the hospital parking lot. C. A hurricane is approaching. D. An unknown caller says there is a bomb in the hospital lobby. Correct answer. D. An unknown caller says there is a bomb in the hospital lobby. An unknown caller stating there is a bomb in the hospital lobby is considered an internal disaster because it directly affects the safety and functioning of the hospital environment. Internal disasters refer to incidents that occur within the healthcare facility and can include events such as fires, power outages, hazardous material spills, or bomb threats. These situations require immediate response to protect patients, staff, and the facility, and may involve evacuations, emergency protocols, and security measures. Question 91. A patient prescribed carbamazepine asks the nurse about its use. The nurse explains that the medication may be used to treat which of the following conditions? A. Alzheimer's disease. B. Chronic pain. C. Epilepsy. D. Parkinson's disease. Correct answer. C. Epilepsy. Carbamazepine is primarily used to treat epilepsy, also known as seizure disorders. It works by stabilizing the electrical activity in the brain and is particularly effective for certain types of seizures, including partial seizures and tonic-clonic seizures. Question 92. A patient has been taking lamotrigine for 2 years. Which of the following would indicate that the patient is experiencing the intended effects of the medication? A. Lower hemoglobin. A1C. B. Lowered blood pressure. Reduced tremors. D. Seizure-free. Correct answer. D. Seizure-free. Lamotrigine is an anticonvulsant medication primarily used to treat epilepsy, particularly in managing seizures. The intended effect of lamotrigine is to reduce or eliminate seizures, especially in patients with conditions like focal seizures, generalized tonic-clonic seizures, and certain types of epilepsy. Therefore, the best indicator of the intended effect of lamotrigine would be the patient being seizure-free. Question 93. What is the most important assessment for the nurse to perform on a patient taking oral contraceptives during her annual pelvic exam and medication refill? A. BUN and creatinine. B. Blood glucose. C. Blood pressure. D. Oxygen saturation. Correct answer. C. Blood pressure. Oral contraceptives, particularly those containing estrogen, can increase blood pressure due to fluid retention and vasoconstriction. Therefore, monitoring blood pressure is crucial during checkups and medication refills, as elevated blood pressure may necessitate adjusting or discontinuing the contraceptive to reduce cardiovascular risks. Question 94. A patient is administered an intramuscular injection of depot medroxyprogesterone acetate. Which common side effect should the nurse inform the patient about? A. Dizziness. B. Increased bone density. C. Weight loss. D. Weight gain. Correct answer. D. Weight gain. Depot medroxyprogesterone acetate, DMPA, is a long-acting form of birth control, often administered as an intramuscular injection. A common side effect of DMPA is weight gain. This occurs in some women due to changes in appetite and metabolism, as well as possible fluid retention. Question 95. Which of the following is considered a potential side effect of subcutaneous heparin in an 8-year-old hospitalized patient? A. Diarrhea. B. Leukopenia. C. Thrombocytopenia. D. Tinnitus. Correct answer. C. Thrombocytopenia. Subcutaneous heparin is used to prevent and treat blood clots, but a significant side effect, especially in pediatric patients, is thrombocytopenia, low platelet count. Heparin-induced thrombocytopenia occurs when the immune system reacts to heparin, leading to platelet activation and a risk of bleeding, making it crucial to monitor platelet levels during treatment. Question 96. Which of the following lab results is unexpected in a patient with Addison's disease? A. Hyperkalemia. B. Hypokalemia. C. Hypocalcemia. D. Hyponatremia. Correct answer. B. Hypokalemia. In Addison's disease, due to the deficiency of aldosterone, the body loses sodium and retains potassium, leading to hyperkalemia, elevated potassium levels, and hyponatremia, low sodium levels. Hypocalcemia, low calcium, may be seen in some cases, but hypokalemia, low potassium, is not typical in Addison's disease. Therefore, hypokalemia is the unexpected lab result. Question 97. While assisting the physician with a lumbar puncture on a patient suspected of having meningitis, the nurse observes the patient displaying symptoms such as cold, clammy skin, rapid breathing, and an elevated pulse rate. The nurse should A. Administer an analgesic. B. Encourage the patient to take deep breaths. C. Continue monitoring the patient. D. Alert the physician. Correct answer. D. Alert the physician. The symptoms of cold, clammy skin, rapid breathing, and an elevated pulse rate could indicate signs of shock or hypovolemic instability, which is a medical emergency. While the nurse continues to monitor the patient, these symptoms require immediate attention from the physician for proper assessment and management. Administering analgesics or encouraging deep breaths may not address the underlying concern, and therefore alerting the physician is the priority action. Question 98. A patient receiving haloperidol for acute psychosis is experiencing extrapyramidal side effects. To counter these side effects, the physician to order which of the following medications? A. Donepezil. B. Quetiapine. C. Trihexyphenidyl. D. Ziprasidone. Correct answer. C. Trihexyphenidyl. Haloperidol is a typical antipsychotic that can cause extrapyramidal side effects, which include symptoms like tremors, rigidity, and akathisia, restlessness. Trihexyphenidyl is an anticholinergic medication that is commonly prescribed to counteract these side effects. It works by reducing the overactivity of acetylcholine, which is thought to contribute to the movement disturbances seen in EPS. Question 99. Which of the following patients is least likely to develop hypernatremia? A. A patient taking anabolic steroids. B. A patient with chronic renal insufficiency. C. A patient with diabetes insipidus. D. A patient with extensive thermal burns. Correct answer. B. A patient with chronic renal insufficiency. Hypernatremia is a condition characterized by an elevated sodium level in the blood, often due to water loss or sodium retention. A patient with chronic renal insufficiency is least likely to develop hypernatremia because renal insufficiency typically leads to the retention of water rather than sodium. In cases of kidney dysfunction, the kidneys are unable to excrete water efficiently, which can result in dilutional hyponatremia, low sodium due to excess water, rather than hypernatremia. Question 100. Which of the following is the least important to assess when evaluating the client's motor skills? A. Knowledge of ergonomics. B. Coordination. C. Balance. D. Strength. Correct answer. A. Knowledge of ergonomics. Motor skills assessments typically focus on the client's strength, coordination, balance, range of motion, and ability to perform specific movements or tasks. Knowledge of ergonomics is more related to understanding body mechanics and how to perform tasks in a way that minimizes strain or injury. While important for preventing injury, it is not a direct measure of the client's physical motor abilities.